Hello, this is Dr. Honorable Uvo with Education Consortium. Yeah, trying to just give opportunities for folks who want to practice in the United States. Hello, how you guys doing? Sheon, Dr. Inye XS Busari, good to see you. Anyway, we're going to be speaking with Dr. Yadav Poonam. She's currently trying to get into school too, but she has an interesting story. She has been involved. Good afternoon, Moyo. Good to see you. Dr. Yadav is currently working with a master's degree, and she has been into a lot of research. So I think she'll have a lot. Okay, I see you, Dr. Poonam. Let me invite you to this. All right, doctor, good to see you.
Hello. Hi, doctor. Good to see you as
Good,
well.
good, good. All right, so we're just going to get started. So we had been talking about pathways to licensure. For you to be able to get a license, first of all, you need to get into the United States. So where did you do your dentistry, your first degree?
So, I did my dentistry from Army College of Dental Sciences. It's in Hyderabad,
Okay,
and I graduated in 2017.
okay. So after you did that, so why did you have it in mind while you were in school that you were going to come to the United States?
So, the couple of reasons, and the very important reason for me was I was first interested in research, and second, I'm really focused on system level changes. So that's why my master's was in public administration, and
Okay,
I want to kind of tailor my research and my MBA degree towards dental advocacy in future.
okay. So what kind of advocacy? What were you what do you mean by that?
So I really want to advocate for various like platforms for foreign dentists, and just not foreign dentists, like dentists around the world, like equity towards education, because some of the paths are not like clearly known by a lot of people out there. So there's a lot of confusion around which would they could pursue and which would be the right path for them, because a lot of people enter into programs and then they realize that that might not be the right fit. So I do want to like spread some kind of education awareness amongst other dentists who are planning on applying to schools in the United States.
Okay, so let me say we are on the same
Yes,
page.
we are.
We are on the same page. That is my. When I left, when I got to University of Illinois at Chicago. A long story to get there, but when I got in there, I saw what they were teaching us, and I was like, I wish I could take this whole thing back to my school so that the students can be better trained. I mean, obviously, the standard here is pretty high. It is what it
Hmm.
is. I mean, dentistry is the same. The tooth is the same. X-rays are the same, pathology is the same,
Yes.
composite is the same as composite, but just the way it is handled, it just makes it different. So you finished in 2017,
Hmm.
and so did you have any family in the United States, or how did you go about coming into the United States?
Yeah, that's a very good question. So yes, I do have my youngest sibling here in the United States. So he's done his PhD in computer science, and he works for Samsung, and he's in California right now. So he came in 2014, and
Okay,
yeah, and I applied in 2017 in the same year, and I came to States in June the following year.
okay.
So
You came into the United States. You applied for the masters and you got accepted.
yeah, so I applied to two programs. So I think there's a very traditional route that everyone goes for, which is the Masters of Public Health. But I took a little different one, Masters of Public Administration. And these were the only two programs I actually applied to, University of California and Wayne
Are
State University.
you serious?
Yes. So,
So
and luckily I got acceptance to both. This is very rare that your application, like, you're basically told to apply for more than 4 or 5 schools, depending upon what your interest area is. But like I said, I was more interested towards the system level change. So I was more vouching towards the MPA degree. And when I got the acceptance from Wayne State, so I came here in June, and just in August, I also got acceptance from California MPH. But then since I already planned on and I started doing my MPA, so I did not go the other
Okay,
route. But
nice,
yeah.
nice. So you got into a, a master's in public administration degree. So so that so if you are listening, sometimes you want to follow this route. Sometimes you just want to follow your heart, or sometimes you just want to get.
Sure.
If you are able to, somebody told me that you have a visiting visa, you can come here do your exams. So there are just many routes, but this one has allowed you to. So you finished. So doing what was your project in your MPA class?
So like I said, I'm very focused on the research. I'm invested in that area. So I work for the community-based organizations, even though I'm working with Michigan Medicine. So my research is focused on helping, individuals with mental health / opioid overdose issues in Michigan. And that's where my whole research area is.
So your research has nothing to do with dentistry?
No, it's more of like a general population. So it's not like completely dental related. And this is very interesting because a lot of students or a lot of aspirants who are thinking of dentistry in the United States, they think that everything has to be aligned. And I'll tell you a very fun fact about United States master's program. Every master program here is tied so well with research. And I feel you can expand yourself in other areas where also you can help other populations, not just dentistry related. And these experiences, these skills, trust me, they're so valuable. Like you already have dentistry in your hand, right? And then having something, outside that arena basically, gives you a feather in your credentials.
I mean, so you're saying, when you come in here, try to think outside the box. Don't get narrowed down. Okay, I must do some composites. I must do some root canals and some.
I'm pretty
for me,
sure.
I'm pretty narrow these days. After prostrating, I just want to do implants and that's it. Okay.
I feel like this is a world where we're living in an integrated society where you need to have like information about every single thing. So I feel like, expanding yourself, letting your wings out there to see what's apart from just dentistry. And dentistry is obviously, like, I'm pretty sure everybody's good at, what they're doing and what state they are in, but then having other factors included in your credentials. I feel like that's.
I see one big research professor right here, Dr. Dennis Tano. Oh my God. It is unbelievable to even have you visit this place. Is a great honor to see your name here. This guy has done so much for dentistry around. I mean, he's I know, Dr. Dennis, if you're here to tell us your story, how you got into the United States, I'll be willing to talk to you. But I just want to recognize you guys. You need to go on Google, go to PubMed and type Dennis Tano, and you are going to sit down and learn for years, because he has so many articles that he has definitely changed dentistry with his practice. But it's good to see you, sir. Anyway, I will check on you if you're willing to talk. I know you're a busy man, but anyway, we have Dr. Poonam here. She's trying to get into school. Dr. Dennis is a professor at Columbia, University of Columbia in New York. You never know. You never know who can be of help to somebody. But we have Dr. Poonam here. She's trying to get into dental school. That's what she wants. And that she's doing some research, and she's trying to share with us today research opportunities. So when you come in here, it started with her getting a master's in public administration degree.
Yes.
Usually, so when I came here, I was like MPA. I got an MPH when I got here, but but this is a good way. So even if you don't become a dentist, I'm just saying, I know you want to. You already have a career. You have done some research, and you are doing something, population level studies that can better. So you can actually have a career doing that. You don't have to necessarily be a dentist. Am I right?
Well, I mean, part of people would agree to it. Like I said, I'm really invested in my dentistry also. It's not just like research. I'm building up my research in a way I can also help my dental related population. But, like you must be hearing news, like dentistry is related with so many other oral health care issues, which I feel like, having a research in a broad spectrum basically helps you even align those different areas to dentistry. So I do want to go back to school, and dentistry, like I said, I'm passionate about, and I do want to practice in future. But like I said, I think research is the first step. And I feel every school here, even dentistry, every program, like research, basically it's valued. And
Okay.
depends upon what you want to do, you can tailor your interest accordingly.
Okay. So there's somebody listening to you right now who is interested in research. I want you to take it away. Tell us, what do we need to do?
So first thing, find out a lab, or, look at the university website, go in and look into what other, dentists or doctors are actually researching into, reach out to that person from that lab, see if they, or, if they have any opportunity, or if they have any, space where they can take some research assistants, or those are the usual positions you look for. And, once you have a match with your interest and what the lab has been working on, I think, you're good to go. Yeah.
Okay. So you find out in research. So in every university, every dental school, there's going to be a research. There's some research going on in the building, So in every school, so you have access to all the dental schools, especially the ones that have, I would say the ones that have a foreign dentist program. I mean, if you're trying to get into that program, then you being there makes. Cause I know someone. She's been research person. And it takes a lot of humility too. So after your MPH and you want to get into school, sometimes you have to work as a research, like research associate, or sometimes you have to work as a dental assistant in a school. Because that way they put a face to your name, and you are seeing them, they are seeing you, and they know what you want to get into, and that's the way to get in. So you just have to swallow your pride, because I know you're a dentist from your country. But until you get your dental licensure, you got to find a way out. So you say, go to every dental school and email them about, look at what they are already working on, so that way you're not coming in with some new ideas that is not funded. You need somebody that is already funded doing something. Then you want to work with them. They always need people to, to run the stuff. So so after that, what opportunities? Take it away. What research opportunities are there for us?
There are actually a ton of opportunities. Like you said, sometimes you just have to, swallow your pride and try to get out and learn, because obviously it's a different country, different requirements, different, different base, like where you need to satisfy, to get where you want to. But if you, there are a couple of dental related research areas, like in every department, endo, perio, prosto, ortho. So you'll have to basically go to that website and see, what they're researching, what's the current topic they're into. So you just have to reach out, or there will be an email, there'll be a contact address for that, particular page. Just email them, talk to them, see if, if things align with you and the research, and then they'll basically.
But do you need any prior knowledge? I mean, doing research, that means you must be comfortable with analysis, with statistics and stuff like that.
That is a very, very good question. So yes, for research, it's yes and no both. Like, you also need like some experience with statistics courses, like, you should be able to run some data analysis, which is a part of, I think, most, like if you're doing a master's in the United States, that will be a part of a curriculum. Like, there will be a research component, which will basically talk to you about, some statistic courses. So if that's where you are, then you're good. But if you don't have a master's here and, you're looking for some research opportunity, there are a couple of hurdles which you need to go through. But I think there are a lot of online courses for statistics that you can take for, literally $50, $49. So you just go through those courses. It's a 6 months course. Sometimes they're just 4 months course. So, once you have the
examples, do you have any examples?
Yeah, sure. So there's like, you must have heard about the Coursera platform. Like, I work for Michigan Medicine, so I get a free platform for Coursera, or even Michigan Medicine platform. Some universities also offer, these 3 to 4 months online research related courses. So you can take those, and I think those will basically help you land some of the research assistant jobs, or, even research analyst, depending upon what the level you have in statistics.
Okay.
Yeah.
I mean, I did put on our Telegram channel something I saw on LinkedIn, how to become a research for free, how to become a research associate. So that kind of course. So there are links to those courses that I placed on there. So if you're interested, if you find a way on my bio page, just go to the Linktree link and click on the Telegram dental licensure Telegram group, you can have access to that, so that at least you can start from somewhere. In terms of looking at data,
Yes.
you've got to be able to understand basic, Excel. I mean, basically, I mean, I think Excel is the easiest, the simplest thing. And you have Google. You don't have to have Excel, Microsoft Excel now. You have Google, with Google Documents, there's the Sheets. And with Sheets, I mean, so that way you get to practice and get your stuff done, understanding, what data, cleaning up data, in terms of all the rudiments. So can you I know this is not what you are here for, but what do you do when you get data? What do you look at? Just give me your 7 points. 7 Poonam points. Like when what
Definitely.
comes to you?
So before I start that, I just also want to put out that LinkedIn also has courses, which is for $29 or something that you can join for, learning about data and
Okay,
statistics.
nice.
That's helped me a lot.
Please,
I have actually personally taken.
send me the link later. Let me post it out there. So
Yeah.
LinkedIn has courses, Coursera has courses, and EDX by Harvard
Yes.
and other schools. Those are really valuable, and some of them are not that expensive. You just got to pay something and get it.
Yeah. Those are very valuable platforms. So yes, coming back to your question about what I exactly do when I receive the data. So I have learned a couple of softwares, and again, not to forget to mention that I have learned these things from LinkedIn, from my employer platform. So I use softwares like SPSS, SAS, R, to basically clean and code that data, the information that we receive. And again, data has multiple levels. You have qual and you have quant data, which you need to sort out and kind of code them to analyze. So there are some basic prereq to actually understand what and how are you going to grow on the data side. But trust me, it's very simple. 3 months of your dedication time on those platforms will actually walk you through what you need to be ready as to do at least basic data analysis.
I think we're going to need Dr. Poonam to come back and give us an intro to just be, even if just to show the links. I think people will benefit, but we'll talk about that later. So the opportunities out there. So how does that help you? So you do your research. How does that help you get into? How do you think that helps you get into? So when you do all that research, are you able to publish a paper?
So yes, I have published 3 papers till now, and again, research is a whole learning new thing, and you need to also have some kind of a learning English writing courses, which is, I think you get, like I said, if you're in a master's program enrolled in the United States, you have all those benefits. You learn these things along with your master's. So you really don't have to worry about, how you're going to learn about the writing and publishing a research paper. So in my current job, yes, I have published 3 papers. And like I said, I work with the mental health and / substance use and opioid use population. So, I mean, I can drop some link from
I'm just jealous of you getting into dental school, and everybody's going to be looking for you because your CV, your resume is going to stand out because you are a published author. You have joined other people to publish. That sets you apart. I'm telling you, because if the first position you get into dental school is an assistant professor, clinical assistant professor position, and that position for 6 years, you have to publish a couple papers because you already have 3. People will be looking for you because you are good at statistics. I think you should, when you get into dentistry, you should get into the academic career. You should at least teach one day in dental school. You will be, Puna, I'm telling you, you will be an asset, because not many people know how to deal with data. Not many people know how to set up, because even as a resident, you are supposed to come up with a research topic, but you going there with you can even look at mental health and the need for prosthodontic treatment. How does mental health affect prosthodontic, the uptake? I'm just coming up with a random topic right here, but I'm telling you, if you search,
I can definitely add to that, a lot of burnout even in dental profession. And let's talk about the opioid population I work with. I don't know how many of you know this, but dental prescribers are the highest in opioid prescriptions. And there are a lot of research papers out there focusing on this issue. So I feel like I'm like I said, I'm really, really looking forward to apply all of these skills into my dental profession.
We're going to, Poonam, we're going to write a paper before somebody steals you away. we are going. Let's talk off camera. We're going to write. We're going to publish a paper. I mean, right here. So you see what I'm saying, guys? If you have any questions, please ask your questions, because this is really going to be driven by the questions you ask. This is our experience. She had dental school in India. She wanted to come to the United States. She applied for a master's in public administration degree. She got in here, and she's working now using what she has learned. And obviously, she's tech savvy. She's analytically minded. So those are qualifications. And she puts that on her CV. The fact that she has published papers, and you got to tone it down. To get into dental school, you now bring it down to what you can do. I'm sure that, right now you can actually teach in the dental school with the degree that you have without having to go to dental school. Obviously, you want to do dental school. You want to get your you want to do it. But I'm saying that right now, because of what you have, you can actually help students publish papers.
Thank you, Dr. Uvo. That's really kind of you.
Sincerely, you could help students publish papers, because that's what you do. And obviously, I'm sure there's a position in many universities, even the University of Michigan. Mm-hmm. Poonam, we have to hook you up with Dr. Ramesh. Dr. Ramesh is a very helpful foreign dental grad. I think he came in all the way from Australia. And he's a dean. He's one of the deans at the University of Michigan. So so there's an opportunity for you to rise in the cadre to become, and let's do it.
Thank you, Dr. Uvo. I would just like to add, I actually have met Dr. Ramesh Talia. There's a very good platform that he has for foreign dentists, it's called Synergy Program. If you look into University of Michigan website, he gives a seminar every year, I think in January. And if anybody out there, want to attend that, it's free of cost because of COVID and since COVID. So I think the rest of the people can also take benefit of that program.
He published a paper out of the data I got from the Synergy platform. So there's a paper that he published. I put the paper on the licensure chats group on Telegram. So the paper is out there for you to be able to read, so that you can tell. Because in the paper, I focus on what the characteristics of people who get accepted. People who get accepted, first of all, you have to be in the United States. You have to be as wealthy as Dr. Poonam, because I don't know how did you pay for your MPA degree?
Well, again, that's a very good question, but I'm not wealthy. I come from a very general population. I wouldn't brag on that piece, but I took a loan, educational, obviously, but it's almost repaid. It's just few left. So I think that's one hurdle that, you have to take care of your finances, because obviously education like dentistry and medicine is not, it's not as, cheap in the United States. So you have to plan your finances beforehand, before applying to any of those schools. And there are a couple of other, there are a couple of options for finances, which you actually have to look into depending on what school you're applying. Some have scholarships. I was on scholarship for my MPA programs, which paid off my $15,000. But the rest of the money was on my education loan, which is, like I said, it's been repaid, a lot of it. So I just have some left. So, but again, you need a nice planning.
That is no mean feat to have. What I'm saying. So, for part of the research, what they found was that people who come in, they are folks who are, because coming into the United States, that means you want to be able to come in for a short time. That means you have money to buy tickets, you have money to stay. You have money to keep yourself here, man. It's not everybody that can afford that. I'm telling you, that's wealthy.
I would say one thing to that. United States, it's a land for opportunities. You can explore, you can learn, you can even, set from the very first day. It's just you have to make an effort to look out. That is what you need to do. And as long as you're seeking out something here, I'm telling you, it's achievable. Anything is achievable here.
You're right. When I got into the United States, I wanted to get into. I wasn't thinking about the money. The only thing I thought about was I wanted to get access to loans. Because when I got in, I came with a green card. I had no credits, nothing. So I waited a little bit. I took some time to become a citizen first. So I'm going to go into dental school as a citizen. That's what I made up my mind to. So I waited for a couple years, 3 years. When I got in, I became a citizen after 3 years. So after then, That
Yeah,
is when I
true.
started going to school because as a citizen, I have access to loans. So for 3 years, I was doing some other stuff. It sounded like I was wasting my time, but I was working as a missionary dentist. I was traveling to different countries, taking teams. When I went to dental school, they asked me, "What have you been doing?" They looked
Yeah.
at my CV. They said, "What have you been doing with yourself?" So I said, "I've been going around the world." You have to use the right words in terms of the underserved. That I take care
Yes.
of the underserved around the world. You know what the guy said? He said, "We want you in our school. We want a
Wow.
guy that takes care of the underserved. We want you in our program." So what looks like I was wasting my time traveling back and forth. My mates are in dental school. I was waiting to become a citizen. Everything works together for you. You just have to be genuine, and that's who I am.
Yes.
I just got back from Mexico. I've not stopped. Since 25 years, I still travel. I'm going to Kenya next couple months to do, and it becomes part of your life. And the dental school is looking for me right now because they want me to lead an outreach department in the dental school. So, so who you are, like I'm telling you, if you get into dental school, they're going to hold you and you're going to teach one day in the undergrad. You're going to teach them research methods. You'll
Thank you.
be
I'm
assistant
kind
professor.
well, that would be something that I would be looking forward to. I mean, I'll be happy to, and I'll be interested in.
No,
But I would,
once I get into anywhere, I'm going to invite you to come and teach research methods. I mean, you will get it straight away. So getting to learn it, you have spent your life doing it. You have publications to show for it. I mean, that is what you do every day. If I ask you, if I bring some data, how do we clean it up? You understand R, you understand SPSS, you understand SAS. Come, let's get you a professor job. I think I mean, I know you want to do root canals. I know you want to be a dentist, but you got to open your mind to all the possibilities. You have
yeah,
to, so when I go into a dental school, I'm going there because, your public health, your master's in public administration degree is going to come into play. You're going to use it in your discourse. You're going to use it in thinking about, how is what of customer, what's it called? Quality assurance. How do people, because quality assurance is key these days. How do patients feel after they left you?
yes.
Somebody has to look at that. And if you're a dentist and you have the training, you're going to be okay. Anyway, guys, we have Dr. Poonam, who has kindly given us some time today, telling us that you can do dentistry and you can do research and you can use that to create a niche for yourself. Does anybody have any question, Dr. Kapadia? Good to see you. Good to see you here. I'm going to, if you have some time, I would ask you to join us. She has a similar experience. Have you met her before?
No.
Okay. I've invited Dr. Kapadia. She's maybe she can tell us a story if you are able to. Doctor, I've invited you, Dr. Kapadia. If you would want to join us, I've sent you an invitation. Join us and let's see. Let's see if you can corroborate all the things that we have said today. But guys, if you have any questions, please let us know. In the next 25th, we're going to have another a foreign-trained dentist out of the University of Illinois in Chicago. Is currently a maxillofacial surgeon right now. So she's
Amazing.
right. America is a land of opportunity. This guy came from Ghana. I saw him in dental school. We were together in that program. He left, and I wanted to do oral surgery, but I just, I'm like, let me just face prosthodontics. It was just too. I just didn't want to do calls. I'm like, no, I'm too old for that. I don't want to do calls. I don't want to be stressed. So, and he did
I
it, and
think
he said,
it boils down to what you want to do and just stay focused.
yes.
And like I said, just be genuine, like Dr. Ubu mentioned, like be true to yourself, be honest in whatever work you do. Everything aligns, like everything has a connection. Nothing is going waste. So, you just have to plan it.
Yes. So if you are out there, I know we are pressed for time here. So if you guys have any questions, please let us know. And we'll call, you always have access. Dr. Poonam is on LinkedIn, so you want to check her out on LinkedIn. If you have any questions, we'll be able to send some answers to you. But the main thing you need to do today is to go to my bio page. There's a link that takes you to a Linktree page. We have a Telegram group called Dental Licensure. so you can ask your questions or you can get some updates on information. We're going to bring Dr. Appiah here on the 25th. He's going to talk about his experience, and we're going to have another student who is in Masters in Public Health School right now. She's going to tell her experience, and we're going to have another doctor who didn't have to go to dental school.
Wow,
so if you
that would be something new.
If you do a Masters in Public Health and you do a residency in dental public, you will do it so well. I'm telling you, you are not willing to leave Michigan. That's the But if you go into that program, they're going to waive up some courses for you because you already have an MPA. If you go to University of Iowa, you will do some dental public health courses, and you will be able to practice in the state of Michigan without having to go to dental school. Do you know that?
I didn't know that.
Are you serious? Oh my
No,
God.
so I never thought there could be an option without doing dentistry, like being able to practice. So I'm still, there are a couple of like advanced programs that I was looking into. So like I said, there are a lot of shady things, like some things people don't know like who are outside the United States. So, my main focus is to make people aware, like what options do you have in states. And like you just told me one, which I wasn't aware of.
And sincerely, there are three. I'm gonna put up. I don't know if I can put up a slide with this right now, but I would do that. So if you do a master's in public health with a residency, all you need to do is to do 3 years of something, of a clinical or some residency of some sort. You don't have to go back to dental school. So I have Dr. Ogechi Johnson. She's working her this week. She's practicing in the state of Texas right now. I'm actually on my way there. And she's actually practicing dentistry, and she didn't go back to dental school. She did a master's in public health, and you can apply. Once you do that, you can apply. You can work in some certain states, about 5 states or 7 states, Minnesota. You can work in Texas. You can work in Michigan and a couple other states. You don't have to go back to dental school. All you need to do is to take the INDBE exam, and you also have to do the ADEX exam, which is a bench prep. By the way, we're going to be offering bench prep in Texas very soon, so that if you want to go for your exam, we'll create the atmosphere for you to be able to just create the exam condition so you can practice and you can get in. So the link is going to be coming up. So that you can do. So Dr. Ogechi is going to come and talk to us about what she did. But I want you to look at it, Dr. Poonam, University of Iowa. If you go to University of Iowa online, they have a combined program where you don't have to do another MPH. So it's a combined dental public health degree. So you do everything, and you attend the conferences, and you can take the board exams, and you become a dental public health person. And while you are in school, at least you have access to the dental school, so you can practice your bench tests while you are there, so that you can easily pass your exams. And once you pass your exams, you don't need to go to dental school. Dr. Poonam is an artist. You guys need to check out her artwork. I mean, I think she's going to make a fantastic dentist because she has excellent hand skills. If you can differentiate between lines and angles and use light, you will be a fantastic. So you are coming to the table. If I look at your resume for dental school, you will be taken.
I really hope that you sit in one of those committees when I apply for the school.
Just tell me. I need to just go there and tell them who you are. You're good with your hands. You are an artist. Dentistry, it's a lot of art. If you're not good with your hands, all your teeth, I mean, you just have some kind of an eye for aesthetics as a dentist. If you don't, you cannot. People are going to be offended when you do work for them. You got to have an eye, and you do have an eye and a hand. So learn something. Learn music. Learn to use your hands to do other things. Because as a dentist, that's who we are. I do carpentry. You just have to do. Dentistry involves everything like that. So somebody was asking for you to share the link to the research course.
Yeah, I think if you visit my profile on LinkedIn, you'll find a link for my work bio. And then from there, there are a couple of things listed in my work profile.
Okay.
It could
All
help
right.
you, look into some research.
I will find it also, and I'll place it on our Telegram group so that you can take a look at it. But anyway, It was nice talking to you. I think you have been, I guess we have given you just a little bit of something to think about. Please go check out University of Iowa's program. You can be a dentist in America without having to go to dental school. It is, you already have it.
Thank you, Dr. Wu. I'll for sure check the University of Iowa without forgetting.
All right. Thank you so much.
Thank
you for your time. I'll look forward to see you guys, next week when we have another person coming up.
Thanks everyone. Have a nice day.
Okay.
Bye-bye.